Good afternoon, and welcome to the Minds Behind the Headlines Town Hall series. My name is Monica Taylor-Lottie, and I serve as the Executive Vice President and Chief Development Officer at Children's Hospital of Philadelphia. The Minds Behind the Headlines series was designed exclusively to host you, our loyal CHOP supporters, in a behind-the-scenes conversation with the thought leaders at CHOP who've been prominent in the news on important COVID-related topics. In the age of the COVID pandemic, the school year will look and feel very different for many children and their families. Schools, colleges, and universities are adopting a wide range of approaches for students to return to school. Some schools have decided to continue distance virtual learning, while others have adopted either hybrid models, including remote learning and in-person instruction, or in-classroom learning 5 days a week with strict social distancing and capacity limits. While this year's transition back to school is different, children will need their parents to help them navigate their new normal and lead the way for a successful back-to-school transition. I have heard from many of my colleagues and friends about their own struggles navigating this challenging landscape. Before I introduce you to our minds for today's session, I would like to direct your attention to the Q&A function, which is located to the right of your screen. At any time during the presentation, I invite you to submit questions, and I will facilitate a brief Q&A to conclude our time together. So please allow me to introduce CHOP's experts who have joined us today. First, please welcome Dr. David Rubin, who is an attending physician, Director of Policy Lab, and Director of Population Health Innovation at CHOP. His expertise about reopening society, children safely going back to school, and other COVID-19 related issues has been featured in national media such as the New York Times and Good Morning America. Please also join me in welcoming Dr. Jonathan Spergel, who is Chief of the Allergy Program at CHOP. He is a member of the group of scientists, physicians, funders, and manufacturers who have come together as part of an international collaboration coordinated by the World Health Organization to help speed the availability of a vaccine against COVID-19. Dr. Spergel and Dr. Rubin, thank you so much for joining us this afternoon.
Hi there. Thanks for having me again, Monica. For everyone out there, I'm just going to speak for a few minutes about our reopening guidance and just let you know that we've been working with our infection control team at CHOP, our sports medicine teams at CHOP, to provide guidance not just for classroom instruction, but also activities around this new school year, which obviously is going to look a lot different. Unfortunately, it's been a rough summer as a lot of areas, particularly our metropolitan areas, have surged to rates of transmission that have called into question the risk for outbreaks originating in schools as we return in the fall. And the data on children has also kind of moved in a direction sort of confirming the likelihood that they will transmit. We saw many more infections in kids in the latter half of the summer as kids started mixing again. We've seen some significant outbreaks overseas at lower rates of transmission in Seoul, South Korea, and in Berlin. And so all that, we're facing very challenging decisions. In last couple of weeks, we actually released guidelines that included some thresholds to provide some anchors for schools to consider alongside their safety plans about how to open schools. And they included a fairly conservative threshold for those schools that would choose to reopen all at once. And the rates that we put there were reflective of the rates that Europe reopened out when they reopened their schools back in the spring. We also provided some intermediate thresholds that were much more akin and very close to where much of our area in Philadelphia is right now, with the exceptions of pockets in Delaware County and in the city, where they might consider bringing their elementary school kids back a little earlier and their special needs kids who don't learn well virtually. But also with the elementary kids, I do think the weight of the evidence still supports that they don't transmit as much, they're less susceptible to symptomatic infection, and that there may be, and the early safety data has actually demonstrated that elementary schools, even down south, have been less likely to close than these larger public high schools. There's obviously everyone gets very impassioned about their kids when they talk about getting them back to school. Like we've got a lot of questions the last couple of weeks. Like, that the kids aren't getting sick. Why aren't you sending them back to school? But our thresholds are really focused on safety, and kids don't live in a bubble. And these school districts are also facing very tenuous discussions with teachers and staff who are fearing for their own safety. And it was very important to us as we developed our guidance, which I would remind people is just guidance, and we join others as well, and our guidance is fairly similar. It's not that different than what the state of Maryland, for example, just put out this past week, or even the state of Pennsylvania. But I would remind people that kids don't that we were focused on safety. That does not mean that schools did not have other things to consider in terms of did they have the resources or spread out campuses or lower enrollment. And we're seeing a lot of our private schools getting ready to open. We're seeing our universities open, some more successfully than others. And we're seeing some ability to leverage resources to do a lot of testing on the way in and thereafter with some strict enforcement around routines and behavior by their students that are allowing some schools to stay open. I just took my own daughter back to Tulane down south, and they did a really terrific job of setting up new pavilions, new ventilation systems. They tested everyone on the way in the door, and I felt confident that they had a chance to succeed. Unfortunately, it's going to be particularly hard for our large public high schools that might face enrollments of a couple thousand kids who may be looking at 10 to 20 kids on day one who are going to be COVID positive, and with uncertainty among their teachers and staff if they're in larger districts, but how well they're going to be able to organize their response, whether these older buildings and these older classrooms will just become the sources for outbreaks in the community. And so, right now we're at a point in our discussion is trying to go district to district, working with superintendents to answer their questions, try to identify windows when they might be able to take a shot and maybe start incrementally with the younger kids. But I would be careful when you hear the headlines. A lot of folks will try to point to the fact that they're going virtually as because of our guidance, when in fact I think they're really deflecting very difficult and challenging decisions they're often having to make with their own teachers and staff. And this is a very sort of challenging situation. There are no easy answers, but it's not simply about the kids. It's about the larger communities they live in, and particularly our teachers and staff who are very worried for their own safety as they return to schools. So I'll stop there. We'll have some more during the Q&A.
Thanks, Dr. Rubin. Dr. Sprigel, we'll move to you into your remarks.
Thank you, Monica. Thank you, David. So I'm just going to talk briefly about a couple things. So my son, I have two boys. One, like David's, my son actually is a freshman up in the University of Rochester, and they were able to open up. They tested everyone, and it's more or less a big bubble there. So they're being pretty successful. And then I have a high school junior that will be going in a hybrid model, going 2 days a week, half days, so not eating in school. That's what they're doing at our local school district. But I just wanted to briefly talk about sort of some risk factors people have and concerns about who's really at risk for sort of complications for COVID or getting SARS-CoV-2. There's a couple things that I think we've learned over the last several months now, and it's definitely changing over time. I mean, when we originally came out, the guidance was, asthma is a major risk factor. And interestingly, that has not been really proven to be the case. The reason why they said that is this is a respiratory virus. Asthma is triggered by respiratory viruses. We should really worry. But we've looked at our institution, and we actually just published, people from our institution just published some data from CHOP, but people have seen the same thing throughout the United States, South Korea, and Europe, that in children with asthma, they're not at increased risk. If anything, they may be slightly decreased risk, and it's a little bit unclear why they're at a decreased risk. There's a couple possibilities. One is they may be doing more careful, so not going out. The other possibilities are that they're being more careful with wearing masks, right? And the last two possibilities are really more fascinating from a truly immunological standpoint. And one is that when we think of asthma, we know it's an allergic disease, and a lot of patients with asthma are on inhaled steroids. And inhaled steroids, we know steroids are probably one of the best therapies for COVID right now. So there's some theories that being on inhaled steroids may be decreasing your complications from COVID. So that's one thing people are looking at. It's really sort of very preliminary, but there is some evidence in test tubes that say that may actually be true. And some of the molecules where the SARS-CoV-2 virus, the virus that causes COVID, it actually binds to this ACE2 receptor, and it's decreased in some people with allergies. So there may actually be some decreased risk factors in patients with allergies. So allergic asthma is actually no longer considered a risk factor. The risk factor is really for the asthma is associated with obesity and smoking. So it's really a little bit different than what we thought. So I think just wearing masks, my good old mask here, has really cut down the rate of infections in hospitals and in schools. So I think that behavior, good behavior in students and in families, makes a huge difference. So I think those things can protect things going back to school. And I'll end there. The vaccine stuff that I'm working on is still too early to say much, but it's progressing. That much I can promise you. There is hope. There's lots of vaccines being tried, and we hope to have some vaccines in the next several months. Not the next month, but hopefully end of this year, beginning of next year, we'll hopefully have some vaccines if things continue to progress as they are.
Great. Thank you, Jonathan. I want to encourage our families and parents and guests to feel free to enter their questions into the Q&A function located on their screen to the right of their screen. But Jonathan, since you've just ended first, I wanted to ask you, what questions should families be asking of their school to ensure that the schools have a safe plan for their kids to return?
I think it's the same questions that you have to make for schools that you think you need in life. What measures are they having to enforce mask wearing and hand washing? How are they going to try to keep down density of classrooms? So when you're in a school, you still need to be 6 feet apart, right? At least in the older kids. Maybe not as true for the really young kids, but at least for the middle school, high school, and college, you really need separation. How are they going to manage separation? How are they going to enforce mask wearing? How are they going to handle sort of a high-risk events like eating lunch? What are they going to do with those questions? I think those are important things to ask. And how are they going to notify, like we do here as a Penn employee of the University of Penn, we do a symptom check every day. Are they going to do a symptom check every day at the school? I don't actually think temperature checks matter much because most patients are asymptomatic, and especially in the children's age, but asking the simple symptom check might make a difference and might help a little.
Okay, thank you for that. And Dave, a question for you is, you talked about early in your remarks that kids are not in a bubble, and so they want to interact socially, and families want to provide their kids with some form of social interaction. So what size bubble do you feel is safe for our children and families this fall?
Well, first of all, I also say, even if these school years start virtually, I've encouraged school districts to actually allow for some traffic to and from the school for activities. This is like Dr. Spergel said, this is about dedensifying hallways and classrooms and people, so having small groups of students return for different activities, I think is a nice way. I can't, to me, we've told my own daughters, and I have 2 in high school here, 3 or 4 friends that they spend most of their time with, but it's similar to our gathering size limitations. It's just applying them to kids, 10, 15 people total at a time. That's what you're trying to kind of aim for. And so for us with our kids, it's sort of identifying families who share your risk tolerance. I'm not sure I'd be happy about my daughters going over to a home where they're constantly having big gatherings and parties there. So I'm trying to identify, a selection of kids, and they're helping, because the answer is not isolation. You have to try to kind of to mix in your strategies to try to spread people out and still provide as much access to school, and I think our goal should be to get everyone back. But school year is going to look a lot different this year in order, even in those districts that open, in trying to de-densify the classrooms and the number of kids circulating the hallway.
Okay, we do have a question that's come into our chat here, and the question is, in order to protect teachers and staff, how important is it that students wear masks? And probably a very tough thing for students to wear masks all day in school. What are your thoughts there, either you, Dave, or Jonathan?
Yeah, started early on. When we came out with the 6-foot distancing, and there was a thought that maybe once the kids were at their desk, they could remove their masks, once they were in their bubble. That it has not turned out to kind of survive time and evidence over the summer. Berlin's outbreak was largely a result of them not starting with masks, and they started at much lower transmission rates. And so, in truth, the reality is, in order to get as many kids back in the classroom, unless you're at really low incidence, there are some boarding schools that have tested all their kids on the way back in, and they really truly know, they're doing a lot more significant what's called sentinel surveillance and testing. They are a lot more confident about the risk of kids spreading amongst each other and to the staff and to their families. They may be able to get away with more than an area like ours that is sort of at tenuous rates. And I would suspect we're going to have masks on the kids with maybe short breaks throughout the day as a way to try to sustain our reopenings. Because once these schools close another time, you can just imagine the amount of fear and trepidation as we're moving towards winter. It's going to be harder to open them again for in-school instruction.
I can't second that enough. I think wearing masks is just going to be a critical thing we do. Besides the ability of a few people have anxiety disorders, there's really no downside. It's probably the reason why we have almost no asthma admissions in the hospital. Right? From an allergy standpoint, it is probably the best medicine I can ever think of for treating asthma. I mean, it blocks the viruses, it blocks the pollen. Those are the two main triggers of people's allergies and asthma. There's really very little downside for wearing a mask.
Mm-hmm.
I've also got a lot of feedback from families. I work a lot with boarding schools and independent schools as well as public schools. I think the parents worry more about the masks than the actual kids do. I think they bother us more than the kids. And I've heard a lot of successful stories where the kids don't seem to be troubled by wearing a cloth or a surgical mask throughout the day.
Yeah. The daycares, I have a bunch of families of first responders who are going to daycares. And even the little kids, so these are now the 2, 3, 4, 5-year-olds, think masks are the coolest things. They like wearing masks. They have different masks they wear during the day. They switch off during the day from the fireman's mask to the the princess mask to all the masks. The kids love it. The kids think it's fun. They think this is a great game. It's not the kids. The kids like wearing the mask. Maybe for the teenagers, but not for the little kids. I really haven't that much of an issue at all.
The same feedback we got. A lot of teachers have actually been working with kids on day one, and they've been designing their masks. They're
custom masks for them.
Yeah.
They're so much more flexible and resilient. Well, we have another question here in the chat, and that is, what is your recommended testing regimens for K through 12 schools and teachers, staff, and students, and before school and or on an ongoing basis? So what is the testing regimen? What should that be?
Well, we're actually doing some writing right now, Monica. The question is not whether our thresholds were too low. The question is what can we do to bring up the safety protocols in these public schools to confidently convince parents and teachers that these schools will not be the source of outbreak. And testing is one of those areas. in many ways, as we've now learned that schools are going to be sites where outbreaks originate in the fall to the community, you might, we would support treating them more like long-term care facilities were back in the spring. If you knew that's where the source of the outbreaks were coming from, we should be doing much more frequent testing, not just asking people whether they're sick. I mean, first it starts with, before we get to the tests, it's sniffles are not getting into the classroom this year. I think there's a commitment by families that if you have a cold, the kids staying home. We used to send our kids, we used to give them a dose of Motrin in the morning and hope that they got through the day and I didn't get a call. But that's not the way this is going to work this year. As far as testing, there are certain places, in addition to this exposure and symptom surveillance, that you would be testing them once a week. And like, for example, children in special needs classrooms, like a child with autism who doesn't, who cognitively can't control, either can't wear a mask or sometimes may bite, or there might be impulse control, and the teachers have to be in close contact. That would be a nice setting if we had testing that would more reliably help the teachers know that they were safe in those classrooms beyond just wearing their masks and trying to go through their protocols. If you're going to go beyond that, then you would start to think about your sports teams, particularly your high contact sports teams, to do some what we call pool testing every day before they go out on the field to make sure there are no positive kids in the group. You're thinking like, your football, your soccer, those types of areas that without that testing, it's very hard to get those sports restarted safely. I just heard about an outbreak among high school football players in the region this week. And then finally, if we had what we wanted, I suspect we'd be doing more sentinel testing like we're doing at universities, we'd be doing in our high schools with kids once a week, in the same way to decant as many positive kids out of the school as possible to ensure that there's public confidence that these schools will be safe.
Mm-hmm. And, here's another great question about risk minimization, which seems to be key. And, would you recommend if there's a student who's gone away to college, they're living on campus, should they return home during the Labor Day weekend, or do you recommend that they should remain on campus? And I guess the same would be true for, Thanksgiving holiday, or if they're planning to do fall break this year. And what are your thoughts related to that, either you or Jonathan?
So I'll start with that. I'll let David. I think it depends on many schools are not letting kids go home for breaks. I can tell you that my son's university, they're up till Thanksgiving, no breaks, and you're not supposed to leave the greater university area. So they're not letting students do that. So they want to create this bubble. I think a lot of it depends on where they're going and sort of what risk areas, right? So if you are in a university in Georgia and you want to go home to Georgia where there's a high community prevalence, and that would be a problem. If you're in Maine or New Hampshire where there's no community prevalence, it's probably okay to go home. So I think it really depends on what's going around the community and where you're going.
Yeah, and I would just add, to support some of Dr. Spergel's comments. I think the good news is I think the Labor Day bump is more of a 2 to 3 week event in this country because all the kids went back to college, and we're already seeing the vacation areas start to abate a bit. I think by mid-September we're going to have a better feeling of where we are in the fall. But I do worry about Thanksgiving. I know that my daughter's school is doing the same thing. Where, they're not, even if they had an outbreak on campus, I think South Bend handled it much better than UNC. If you made the decision to bring your kids back to these schools, you should have quarantined them in place, because putting them back on airplanes to then go seed their, to infect their parents and then seed their communities was not an ideal solution. I think Thanksgiving to me is, if I'm looking at the calendar, that to me has the potential to be a very sort of challenging event because we're not going to tell our kids not to come back for Thanksgiving. It's just not going to happen. And so we're just going to have to be thoughtful about how when our kids come home from college, that we try to come up with our own rules in our own house to try to maintain some distance and prevent the likelihood of transmission really originating from that what should be a good holiday.
So there's a question here that the Wall Street Journal articles about pediatric patients who are experiencing long-term symptoms suggestive of dysautonomia following COVID. Are we seeing that at CHOP right now? And what would you recommend to families with children with POTS or dysautonomia in terms of strictness of isolation?
So, I mean, you always get, there's always these rare exceptions of people getting long-lasting symptoms. In pediatrics, it's generally not the case, but there's definitely cases where it happens. I think for patients who have underlying medical conditions, and it depends on which ones, you do need to do special precautions. I think patients who have impaired immune systems, you want to be a little bit more careful and be stricter with isolation. So patients with primary immune deficiencies, patients with undergoing chemotherapy. The patient with POTS is probably a little bit less clear with those, because often POTS can, depending on how severity the POTS is, because often POTS can be just treated with just salt and more water, and so it's simple measures. And that's for the mild ones, they probably don't, but if someone is severe, maybe they need to be more isolation. So I think it depends on an exact patient and exactly what their individual risk factors are.
One thing that's been exciting for me, I think positive for us, is just how few kids with special health care needs have been disproportionately impacted. In a typical flu season, those are the kids you worry about the most. I've spoken to some of our leaders at CHOP, like kids with congenital heart disease don't appear to be at any extra risk from other kids in getting complications from COVID. I think it would be, even our oncology program has not reported a significant change, but this was during a time when we were isolating all of us, and so it probably seems prudent to protect the kids who are immunocompromised, but other kids with, let's say, congenital anomalies or congenital heart defects, I don't think the evidence would support isolating them from from being in the school day. That the lower predilection, particularly for the younger kids, is protective to them as well.
Well, I want to thank you, Dave and Jonathan, for joining us today. This is such an important topic, and I know that we could spend probably another half an hour answering questions and continuing the conversation. I want to thank all of you who submitted questions, and we will compile all unaddressed questions and share our experts' responses via email shortly. So I apologize that we weren't able to get through all of them. Our students, parents, and school staff, the healthcare community, and other stakeholders are important collaborators in navigating back-to-school scenarios. And while we may not know exactly how the school year will look, together we can ensure a successful school year for our children and their families. At CHOP, as we follow the developments of COVID-19 pandemic, top of mind for us are the children and families facing increased academic and social emotional challenges, as well as significant health and economic challenges during this crisis. We have been extending our support by being one of those important collaborators for the health and well-being of families. Our frontline health and service workers, team members, and policy leaders have been working tirelessly in keeping families safe and healthy and mitigating the long-term consequential impacts that the pandemic could have on the well-being of families. Our Policy Lab team members at CHOP, alongside colleagues in CHOP's Division of Infectious Diseases, have compiled a policy review to support local jurisdictions and school administrators in their plans to safely reopen schools. These health and safety considerations have been referenced in several school reopening plans nationwide, including right here in the School District of Philadelphia. The Policy Lab has also been providing their guidance and expertise on reopening society and children returning to sports. You can learn more about the Policy Lab's health and safety considerations for reopening schools and access their tools and resources by visiting the website on your screen. Donors like you are vital to ensuring that CHOP's pace of breakthroughs for children and families isn't slowed by the pandemic. Your generosity is essential in supporting our continued response to COVID-19 and for the treatment of our patients and families. If you're interested in learning how you can support our COVID-19 response or any of the work that we do, care for children and families every day, please visit the website on your screen. I'd also like to invite everyone on today's call to join us again for our next session, which will take place on Thursday, October the 1st. During that session, we will be hearing from Dr. Kenneth Ginsberg, co-director of the Center for Parent and Teen Communication. Dr. Ginsberg will share insight on adult modeling around resilience, as well as other aspects of youth resilience. So for now, I really want to thank you so much for your time today, and I hope that you have a wonderful week. Thank you, and be well.